Vitamin B12 is an essential nutrient that plays a key role in the human body. It helps with the production of red blood cells and keeps the nervous system functioning properly. Vitamin B12 is also important for DNA synthesis and cell division, which is why it's often recommended for people who are pregnant or breastfeeding. In this video, we'll take a closer look at vitamin B12, including what it is, how it works in the body, and the symptoms of a deficiency. We'll also discuss the recommended daily intake of vitamin B12 and some of the best foods to eat if you want to boost your levels. So if you're ready to learn more about this important vitamin, stay tuned. What is vitamin B12? As mentioned earlier, vitamin B12 is an essential nutrient that plays a variety of important roles in the body. It's involved in the production of red blood cells and helps to keep the nervous system functioning properly. Vitamin B12 is also necessary for DNA synthesis and cell division, which is why it's often recommended for people who are pregnant or breastfeeding. Vitamin B12 is a water-soluble vitamin, which means that it can be dissolved in water. This is in contrast to fat-soluble vitamins, such as vitamins A, D, and E, which can be stored in the body's fat tissue. Because vitamin B12 is water-soluble, it's not stored in the body for very long, and so it's important to consume it regularly through diet or supplements. There are several different forms of vitamin B12, but the most common form found in supplements is called cyanocobalamin. Other forms include hydroxocobalamin, methylcobalamin, and adenosylcobalamin. All of these forms are equally effective at raising vitamin B12 levels. How does vitamin B12 work? Vitamin B12 is involved in a number of important biochemical reactions in the body. It acts as a coenzyme, which means that it helps other enzymes to carry out their functions. One of the main functions of vitamin B12 is to help the body produce new cells. This is important for a variety of reasons, including the production of red blood cells and the growth and repair of tissues. Vitamin B12 also plays a role in the synthesis of DNA, which is the genetic material that's found in all cells. It's also involved in the metabolism of amino acids, which are the building blocks of protein. Who needs vitamin B12? Because vitamin B12 is involved in so many important functions, it's important for everyone to get enough of this vitamin in their diet. However, there are some people who are more likely to be deficient in vitamin B12 than others. These include vegans and vegetarians because vitamin B12 is only found in animal products. People with digestive disorders such as Crohn's disease or pernicious anemia are also at risk of deficiency because the body needs to absorb vitamin B12 from food in the stomach. What are the symptoms of a vitamin B12 deficiency? The symptoms of a vitamin B12 deficiency can vary depending on the severity of the deficiency, but some of the most common symptoms include fatigue, weakness, pale skin, dizziness, and blurred vision. In more severe cases, a vitamin B12 deficiency can lead to anemia, nerve damage, and even psychosis. If you suspect that you may have a vitamin B12 deficiency, it's important to see a doctor right away. A simple blood test can check your vitamin B12 levels, and your doctor can recommend the best course of treatment. Treatment for a vitamin B12 deficiency usually involves taking a supplement. In some cases, a shot or injection may be necessary. How much vitamin B12 do you need? The amount of vitamin B12 that you need depends on a number of factors, including your age and overall health. However, the following are the general recommendations for adult vitamin B12 intake. Women should aim for 2.4 micrograms per day, and men should aim for 2.8 micrograms per day. It's important to note that these are just guidelines, and your individual needs may vary. If you're pregnant or breastfeeding, you'll need more vitamin B12. What foods are high in vitamin B12? As we mentioned earlier, vitamin B12 is only found in animal products. This includes meat, poultry, fish, eggs, and dairy products. There are no good plant-based sources of vitamin B12, so vegans and vegetarians need to be especially careful to get enough of this vitamin. Some of the best sources of vitamin B12 include beef liver, clams, trout, milk, and yogurt. Is it possible to overdose on vitamin B12? Because vitamin B12 is water-soluble, it's unlikely that you'll be able to overdose from food or supplements. Any excess vitamin B12 will simply be flushed out of the body in the urine. However, there are some people who may want to avoid high doses of vitamin B12. These include people with a history of blood clots or those who have had a recent surgery. High doses of vitamin B12 may also interfere with certain medications, including blood thinners and anti-seizure medications. So it's always best to talk to your doctor before starting any new supplements. Can you get vitamin B12 from supplements or injections? Vitamin B12 is available as a supplement or injection, usually in the form of cyanocobalamin. This is the most common type of vitamin B12 supplement and is often used to treat a deficiency. Injections are usually reserved for people who have difficulty absorbing vitamin B12 orally, such as those with digestive disorders. When taking a vitamin B12 supplement, it's important to follow the directions on the label. Most supplements should be taken with food, and some should be taken on an empty stomach. It's also important to store supplements properly, out of reach of children, and away from heat and moisture. Do you need to take a vitamin B12 supplement? Now that you know all about the importance of vitamin B12, you may be wondering whether you need to take a supplement. The truth is that most people will get all the vitamin B12 they need from the foods they eat. However, there are some exceptions. Vegans and vegetarians are at increased risk of deficiency because vitamin B12 is only found in animal products. People with digestive disorders such as Crohn's disease or pernicious anemia may also have difficulty absorbing vitamin B12 from food. Finally, as we get older, our stomachs produce less acid, which makes it more difficult to absorb vitamin B12. This is why some older adults may benefit from taking a supplement. If you're not sure whether you need a vitamin B12 supplement, talk to your doctor. They can perform a simple blood test to check your vitamin B12 levels and advise you on whether or not you need a supplement. Is there anything else you should know about vitamin B12? In addition to the topics we've already covered, there are a few other things you should know about vitamin B12. First, another thing to keep in mind is that vitamin B12 is a very potent substance. It's important to follow the directions on the label and store it properly out of reach of children and away from heat and moisture. Thank you for watching. Thanks for watching. If you found this video helpful, please like and share it with your friends. And if you haven't already, be sure to subscribe to stay up to date on all our latest health and wellness content.